Now I'm going to demonstrate an interpretation of an ECG using a systematic approach, and this helped me learn to interpret ECGs, as it can be a difficult skill. So to start off with, you work out the rate of the ECG. This can be achieved by counting the large boxes, and 30 of them, to a point here. Now the purpose of this is because each large box is 0.2 seconds. 30 of these boxes will make up 6 seconds. 6 seconds times by 10 is 60 seconds, which is a minute. So if we work out how many QRS complexes occur within this 6 seconds, if we multiply this by 10, then this will give us our beats per minute for the rate. So if we look at this ECG, there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Therefore our rate is 110 beats per minute. Now the rhythm. This is whether the rhythm is regular or irregular, and this can be achieved by using a piece of paper, matching it up to the tops of the QRS complexes, and marking 3 lines, which I've already done. Then drag this across and ensure that it matches up with all the QRS complexes. If it does, this is regular. If it does not, then it means it's not regular. This ECG does, therefore the rhythm is regular. Next is the P wave. Ensure there is P wave association before each QRS complex. This can be seen here: a P wave, QRS complex T wave, P wave, QRS complex T wave. For this ECG, there is P wave association. The next step is to ensure that the P wave is the correct length of time. So if we look at this P wave here, it is 1.5 boxes. Each of those small boxes are 0.04 seconds. Therefore the P wave is 0.06 seconds. It's 1.5 boxes. And this is shows the normal P wave, as a normal duration is less than 0.1 seconds. Next is the PR interval. This interval is from the beginning of the P wave to the start of the R wave. So if we look at this ECG here, the PR interval is half a box plus 1 box plus another box plus another half, which is 3 boxes in total, which makes it 0.12 seconds long. Normal PR interval is 0.12 to 0.2 seconds, so this is a normal PR interval. Next is QRS complex. So this is to ensure that the QRS complex is not wide. So if we look at the QRS complex here, it's 1.5 boxes, which makes it 0.06 seconds. This is normal for a QRS complex, as a QRS complex is normally less than 0.12 seconds, which means it's a normal width and it's not a wide QRS complex. This shows that there is association, and the conduction is not coming from anywhere below the junction. Next is ST segment. ST segment is measuring that the ST segment, which is the beginning of the S to the beginning of the T, that it comes back to the isoelectric line. Now this line is the baseline of the ECG and is measured across here from where the P wave comes back to the isoelectric line, and where the ST segment should also come back to the isoelectric line. Now this comes back to the isoelectric line here, this ST segment, and all of them do. There's no elevation or depression. Elevation or depression can be associated with infarction or ischemia of the heart. So the ST segment is isoelectric. Next is ensuring there is T wave after every QRS complex, and that the T wave is of normal length. So if we measure it here, this T wave is from the first inflection is 1, 2, 3 boxes, which makes it 0.12 seconds. Now T wave can be 0.1 to 0.24 seconds long, so this is a normal length for a T wave. Lastly, then we can give our interpretation. So the rate is over 100 beats per minute, it's 110. This is fast, therefore the rhythm will be tachycardic most likely. But it's regular, there's P-wave association, and the P-wave is normal length. PR interval is normal length as well. QRS complex is narrow, it's not wide. There's no ST elevation or depression. T-wave association with normal length. And there are no other premature complexes that we can note there. Therefore, the rhythm is sinus rhythm, but it is fast, so it's sinus tachycardia. This systematic approach can be done to any ECG and is a great way to approach any ECG when attempting to interpret it.